Hello, my name is Dr. Lynette Johns, and I'm the Director of Clinical and Scientific Affairs at Visionary Optics. It is my distinct pleasure to introduce to you Dr. Emmy Tien. Dr. Tien completed her cornea and contact lens residency at Marshall B. Ketchum University. She is currently practicing in two private practices in the Bay Area. We have an exciting presentation about the role of OCT when fitting scleral lenses, and I look forward to hearing your case, Dr. Tien.
Thanks, Dr. Johns. My name is Dr. Emmy Tien, and today I'm going to be presenting on the role of anterior segment OCT in scleral lens fitting. So for our case, we have a 56-year-old Caucasian male who has a history of keratoconus that is more severe in the left eye than in the right eye. If we take a look at his pentacam tomography scans, we can see two classic signs of keratoconus. The first is inferior steepening of the axial curvature map, and the second one is posterior elevation of the corneal elevation map. If we take a look at the colors comparing the right eye to the left eye, overall the colors are warmer on the left eye, indicating steeper keratometry values and therefore more severe keratoconus. This patient was refit from hybrid lenses into scleral contact lenses, and we chose to utilize the Europa Tangent scleral lens design for this patient. If we first take a look at the patient's right eye, this anterior segment OCT shows us nicely the relationship between the scleral contact lens and the patient's cornea. We can see areas such as the central clearance, the limbal clearance, as well as the edge profile. If we zoom into the center portion of the lens, we can see that after settling, we achieved a central clearance of 420 microns on the first lens, which is greater than what I would consider acceptable or a good fit of a scleral lens on a patient's eye. So utilizing the Europa Tangent design, we were able to bring down that sag about 100 microns by flattening the base curve, achieving a central clearance of 299 microns on the second lens, which is more acceptable. If we look at the anterior segment OCT of that second lens, we can see that we were still able to achieve good central clearance, limbal clearance, as well as the edges were nicely aligned with the patient's sclera. If we take a look at the vertical cross sections of the right eye, we can see that between lens 1 and lens 2, there is a decrease in that overall sag, bringing the lens closer to the corneal surface. I did want to point out that because the keratoconus on the right eye was relatively mild, there's a slight bulge of that inferior cornea or that cone relative to the superior cornea, but overall the surface is still pretty regular. If we then take a look at the patient's left eye, on this horizontal cross-section of the first lens, you can see that we had an excessive central clearance of 700 microns after settling. The problem that we ran into on the left eye is that if we take a look at the vertical cross-section, you can see that because of the severity of the keratoconus, he has a more elevated or steeper cone on the inferior surface. So if we take a look at the thinnest point of clearance, where the lens is closest to the cornea, we only had a clearance of about 258 microns over the apex of that cone. So if we were to do something similar to the right eye and bring down the overall sag of that lens, we would run the risk of touching that apex of the cone while still having an excessive central clearance. So this is where the Europa Tangent design comes into play, where we can customize how much we decrease the sag by in both the central area of the lens as well as the mid-periphery. So by utilizing that design, we were able to bring down the central clearance of the lens about 400 microns. Between lens 1 on the left side and lens 2 on the right side, we achieved a difference of about 373 microns after settling. So then if we take a look at the vertical cross sections of the patient's anterior segment OCT, we can see that over the apex of the cone, we only brought down the central clearance by about 163 microns. So this is an example of how we can utilize the Europa Tangent design to better contour the lens over this patient's unique corneal shape. These are the parameters of the final lenses that we finalized for the patient. We utilized the Europa Tangent design in a 17.0 millimeter diameter. You can see that the sag of the left eye is greater than that of the right eye, corresponding with the severity of the keratoconus. Both lenses had a myopic power, and the patient was able to achieve a good acuity of 20/20 in each eye. Both lenses also had a toric haptic to better align the edges of the lens to the patient's sclera. Thank you for listening and for your time today.
Thank you, Dr. Tien, for a wonderful case presentation, and thank you for everybody that's watching. We appreciate your time and attention from Visionary Optics.